Hi, thank you so much for this comment. I'm going to try and answer it in two parts. So let's talk about the part where, hey, I think I have essential tremor. I'm going to the doctor. What kind of things can I expect? How is it that they will diagnose me? It's important to note that there aren't really any real medical tests that can test for essential tremor. You're sort of ruling other things out, and then what you're left with is essential tremor. At least that's the case currently at the time of this video. So when you go into the doctor, and let me note here, it's really important, if at all possible, you go and do your diagnosis with a movement disorder specialist. It is a neurologist that has specialty training in movement disorders like ET, Parkinson's, ataxia, dystonia. So things like that that they're used to dealing with. But what they're going to be looking for, they're going to evaluate your tremor while you're in the office. They might ask you to draw what's called an Archimedes spiral, where you're kind of drawing a line in a circle, and they're going to look at your tremor. They might have you hold things, point at things. They'll have you maybe pour water from one glass into another. So they're going to be looking at the kind of tremor that you have. What does the shake do? They might ask you questions while you're doing it to see if there's any change to the tremor while they're actually speaking with you. They're going to look at balance and gait. So they may have you walk a little bit so that they can evaluate that as well. They're going to talk to you about any kind of falls or anything you might be having. And then there's some other things that are really important, that they're going to ask you what all medications that you're on. And it's really important that you tell them. And this includes over the counter meds, this includes vitamins, supplements, anything that you are taking. Please take a list along with you when you go, because there are medications, both prescription and not, that can cause a tremor to make you think you have either ET or Parkinson's, but you really don't. Some of the common ones that you may be on, even for a short period of time, would be medications for anxiety or depression. Those can cause a tremor. And if you're only going to be on them 6 months, a year, your movement disorder specialist may actually keep track of you for a few years, because they need to rule out other factors that could potentially be causing the tremor before they say, yes, you definitely have ET. Thyroid medications can be another one that's common, that they need to make sure it's not the thyroid or the medication that you're on that's causing it. Another one, I know there are plenty of people that like their coffee in the morning. I am a tea drinker, but they're going to look at your caffeine intake. Too much caffeine, that can cause a tremor. Stress is another one. They're going to ask you what's going on in your life, and please be honest with them. And emotional stress is huge, that can cause tremor. So putting all of those things together, they're also going to compare what you have and your symptoms to Parkinson's, to dystonia, and they're going to try and pick out the differences. Essential tremor a lot of times is bilateral, so meaning both sides, where Parkinson's is most commonly associated with just one side of the body, but that's another thing they might be looking for. Please remember, I'm only saying this as part of my experiences and my knowledge, but it's best to consult a doctor for true, correct information. Hopefully, this gives you an idea of what's upcoming for your doctor's appointment so that you can talk to them about it.
Like, follow, subscribe, and above all, please share to spread the word about essential tremor.